I like how I'm your
All right, so good morning, Chalina.
good morning.
Welcome to sorry, my childcare teacher's after hours podcast. You are my very first person that I get to talk to and interview, so I'm super excited. And for y'all that don't know, she is my best friend. So excuse the midday laughter as we do it. But the purpose of this podcast, honestly, is just to shed light to the many people who do so many things with kiddos under the age of 12 and the different avenues of it. So, Shalina is a lead RBT. I want her to tell us a little bit about what got her interested in doing RBT work first, and kind of her passion behind it. So, Shalina, go ahead and share that with us.
What got me into it was honestly a lead of faith. Um, I did preschool for about 15 years, and I guess I just came to an end crossroad of where I wanted to leave and broaden my horizons with all of my um, intelligence with it, my background history. So honestly, I have been in school to go do teaching for autistic kids for special ed. Um, how I've been seeing how they're not supported, I kind of changed my degree plan. So I got on Indeed, prayed about it, prayed. And then all of a sudden I kept seeing RBT, RBT, RBT. So I'm like, okay, what is this? So I Googled it and I'm like, okay, it's the same thing except for I get, the pay is more worth it, which the pay is nothing. It doesn't mean nothing, is what I mean. But I still, at the end of the day, get to be with kids on the spectrum and I get to teach them like educational and life skills.
I
So
love
I
that.
took a leap of faith and here I am, killing it.
Hey, yes. So, honest question, childcare setting or RBT work? Which do you prefer now?
Honestly, RBT. But I'm not gonna lie, at a center, it's almost just like a daycare, or well,
Yeah.
I can't say daycare, but it is almost like it's just a full school of
Yeah.
nothing but special needed kids, and it's
Yeah.
set up and equipped for all their needs. So
Yeah.
you're supported in many ways versus like if you're at a preschool and you have needed kids there, behavioral children there, you might not have
Yeah.
things
Those
to accommodate
resources.
them. Yeah, you
Yeah.
don't have the resources for them. Um, let alone do you have like most people that work in preschool, some of them don't have the knowledge to like how to bring them back down from a
Yeah.
tantrum, how to
Yeah.
sit down and just like let them, do whatever. If one of them's aggressive, like what do you do?
Yeah.
So I mean, I kind of like the RBT a lot more. Of course, preschool always has my heart, but
Yeah.
I'm enjoying my time where I'm at now.
Yeah. Okay. So, the first question I want to ask you is more of a situational and behavioral based question, okay? And it
Okay.
is, how do you collaborate with other team members such as BCBAs, parents, and other RBTs to ensure the best outcomes for the kiddos that you work with every day?
So what we do is called soap notes. And then in our iPads, I mean, I could show you if you want. We have dialogue that we take. So like we time every tantrum, every time they elope, walk away, any aggressions. And so at the end of the day, it's what we call ABC data. It can get excessive depending on the child and behaviors. But at the end of the day, you want ABC data because it tells you the antecedent, like what happened before, what the kid did during the behavior, and then what was the consequence, like what did I do? And that could go to like just sat back and let them de-escalate or like basically tear up the room. Or we have blockers for those who are aggressive, or it could just be something just simple as like maybe they just need a hug, but they don't have words to just say, I'm sad or I'm mad. So we also go to these things, what we call zones. And the zones have like different colors. I think it's like green, red, blue, and yellow. And so like green is like all of the happy emotions. Yellow is like tired, frustrated. Blue is like sad, tired. Red is like angry, mad, whatever. And so the kids are able to like point to how they feel. And depending on how that is how you respond. But to fill it out 100% accurate, we do have team meetings once a week. And so not everyone has the same client. So like every day I have someone different. I do the schedule. So I make sure that everyone does something different. Because at the end of the day, you don't want just one child only responding to one person because it gets them nowhere whenever you're out on break or you're on vacation, you're out sick, then it literally just tosses their whole day up. So we set them up for success. But we do meet up once a week. We call them team meetings. We discuss kids we struggled with that week who did amazing that week. And we just kind of like, oh yeah, like, hey, like this is what I did to help. So like we're working on a few kids that do potty training. And I've noticed like the little medical gloves, I'll blow them up into like a big old balloon
Mhm.
and it keeps them entertained on the toilet. And I will let it go and it flies up and they love it. But now that others are taking them, they don't reset to them as
Yeah,
much. So I give them pointers on like what I do. And a lot of this, like I've given them pointers on things that I've learned in preschool. Because we do have 2 to 8-year-olds in our center. Granted, we do go from like 2 all the way to adulthood.
right.
Um, but while talking to parents, we are pretty open about everything.
Okay.
We're open to everybody. We just don't go in depth like, oh yeah, Johnny slept
Yeah,
Ariel upside her head today and left a big
right.
old mark because he was so upset. We keep everything objective because we don't know what's going on. We just go off of what we see in the moment and how can we fix it to get them to best explain how they feel and work on their words.
Right. And that's factual. And that goes hand in hand even when you work in childcare, right?
Mhm.
We don't say
Yes,
literally what happened.
your friend.
Exactly. You don't give your opinion. You state the facts of exactly what you
Hmm.
saw. So I love that y'all are able to bring that, but also too, it sounds like a lot of social and emotional work too, as well, being able to regulate emotions, identify
Yes,
your emotions. A lot of times I feel like some child cares miss that. You know, they're very
yes.
academic. Can you write? Can
They're
you
too worried
spell?
about focusing on the educational part.
Absolutely. When social and emotional is a big aspect. So I love that you mentioned that. Okay. So with that being said, what are some ways that you build relationships with some of your kiddos who may struggle with speech or just kind of have that difficulty communicating?
Each kid is different, so it kind of varies. But we build rapport with clients with just bonding with them. So
Mhm.
we just pair ourselves with fun, 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 right? We give them anything and everything they want. If they ask for
Okay.
candy 9 times a day, we give it to them. Uh,
Mhm.
parents probably hate us, but once parents see like so we just opened our clinic, so now it's a little different to the aspects to where parents don't see everything that we do during the day. But I got the privilege of doing this while in home before we opened up our center. So parents got to see me just give, and their eyes are like, oh my God, like you're just spoiling them. And then now that they see like the kids prefer me over them, it is kind of heartbreaking sometimes, but it feels good. Like it's us teaching them, like, even though you're giving them what they want all the time, it's just building that trust bridge into
Yeah.
where, like, then out, like, we do a 2 week thing. So, like, after 2 weeks, you build that strong rapport, fun, fun, fun. Like, we go outside and play in water every single day. We have kids that play in mud every day. So, we don't just go to work all did up like normally.
Yeah.
I got no makeup on, my hair's thrown up in a bun because I already know I'm about to get tore up. Um, but it's just like pairing yourself with just anything and everything that they want. But then after 2 weeks, you
Mhm.
slowly start like holding back. Like if they man to go outside, some of them are nonverbal, some of them are. They
Mhm.
just don't know how to communicate it, right? So like I have one little boy, he can grab me by my hand and he'll look at me in my eyes and
Mhm.
he will lead me where he wants to go. I know he's got words. He chooses when he wants to. So now that I have that bond, I'm like, no, you got to use your words. What do you want?
Yeah.
And so the younger that they are and depending on their verbiage, we kind of
Mhm.
keep it very short. So like open, door,
Mhm.
outside,
Mhm.
eat. We do sign language as we do everything else, but like we do have ones who are a little older. They have a lot of verbiage. And so when they're like, outside, I'm like, no, I want outside, please. And I want outside, please. It's still teaching them. And like, we don't make them use manners, but that's on the parents' discretion. So like, one little boy, mom's like, no, he uses his manners. He says, please, thank you, all done, or go away, please. I'm all done. And
Mhm.
we respect that. So we just carry it through and then we expect the same in return, like what we do at the school and how we talk to them, they do it at the house. And the parents are starting to see like, oh my God, this is working. Um, we do have kids that are completely nonverbal, but they have what we call an ACC, which is a tablet.
Mhm.
They get it from like speech therapy. School districts sometimes disperse them out, but they're not as equipped as some that do like the speech therapists from insurance claims and doctors and
Okay.
stuff.
Okay.
Those are more in debt. So a lot of them, they do use it. Once it's new, we just carry it around. We don't force it, right? Because
Right.
if you're forced to do something that you don't know, you're going to be looked at like, excuse me, like,
Yeah.
no, no, ma'am. So we kind of just like baby step into it. It's just the same as like pairing it. And then you just, like right now we have a little boy, he has one and he has like 10 different demands on there. And I'm like, no, like, no.
Yeah.
So I'll tell him like anytime we get ready to do something, like ready, set, and he'll hit go and
Mhm.
we'll go. And
Okay.
now it's like he babbles. And so as long as he babbles and he's doing whatever, we praise him. We do
Okay.
anything and everything to make it seem like,
Yes, it's
yes,
the little things. Absolutely.
yes,
Yes, I love that. Okay, so with that being said, it seems like you guys are very intentional about your
yes.
actions with the children and with the families. Tell me a little bit about how that reflects with your peers, so the other teachers that are underneath you, because I know you are a lead BT. How do you handle conflicts, disagreements with your team, particularly regarding intervention strategies or behavior plans that may need to be implemented?
So our behavior plans come from BCBA, which like for my company, it's Ariel, which is the boss, the owner. And in all honesty, like her educational level and seniority level, like everything makes like it plays in effect. So what she says and what she writes out pretty much goes, except for like some people in some companies you can get, they're like, nope, it's my way or the highway. However, with her, it's like, y'all are with them like 6, 7 hours a day. Like, do y'all have
Right.
feedback? What do y'all feel like might work better? So with me and one of the other girls, we have me who's the lead RBT, and then we have what we call a case manager. So the case manager, she'll go around, which I will soon be one of those because I'm almost done with my bachelor's. Um, she goes around and she basically observes, right? So like me as an RBT with a kid, she makes sure that I'm following their protocols. And it can go to like the littlest stuff to the biggest stuff. We have one that during feeding times, because they don't know when to stop, they just keep shoving their mouth, right? We choke a lot at foods. We throw up a lot during eating. So she made it a point to where like 20 seconds between every bite, but before the next bite, you have to give them a drink of water. And if you don't follow that, it could go to like a write up to a fireable offense, depending on how she feels. Then she could do whatever she wants. But normally, if we have any issues, we just bring it up in a team meeting. We all agree, and she is very big and adamant about we're all grown adults. We should be able to talk as such.
Absolutely.
If it's something that's not really appropriate, I guess. Like if it's more of like a one against one type person, like if it was me
Right.
against another girl, why would we go and talk about that in the meeting unless like she's basically trying to like draw the line across the board. Um,
Right.
we normally all get along. We'll question each other, but it's out of respect,
Okay.
which is what I like because it's basically just giving each other honest feedback. Like, well, why did you do this?
Hmm.
Well, they all come to me because I have so many child experiences like in childcare. But a lot of them are a little older too. They got kids as well. So it's like, well, this is how I did it with my kid. Like, I don't understand that. And you
Yeah.
have to like break it down to another level. Well, X, Y, and Z ends up with A, B, C, and da da da. And then it's like a oh moment, like some people don't always know because sometimes this line of field is different, but we have open discussions about it as long as we're respectful about it. But at the
Absolutely.
end of the day, like anything that happens, it has to be through BCBA. Whenever we write out their plans, normally we have like a soft demo, which is like we assess the kid, and then like the first 2 to 3 weeks, maybe a month or so, depending on how they are, because some kids show their true colors more than others, once they get comfortable. And so I feel like once we get that real, like I'm settled in, I'm comfortable, let me show you what I can and can't do
Okay.
type thing, then we kind of like edit it to where it's like, okay, this kid needs da 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 da. And then that's when she comes in and she's like, hey, y'all are with this. Like, then that's where like the first question comes from. Like, we collaborate. ABC data comes into place of like what works, what doesn't work. When this happened, then a big tantrum or aggression happened. So we're not going to do that anymore and just go from there, honestly. But we're all grown.
Big word, and I don't even know if you've realized it. Collaborate. Like you guys take time to
Mhm.
collaborate, which is a big piece of what is missing for a lot of people
Oh,
in a
yeah.
center-based setting is the ability to collaborate, to communicate, to freely express how you feel, right? If
Without
something
offending
works.
other people.
Right. If something works for you that maybe didn't work for someone else, being able to have that freedom to collaborate and have those conversations, because at the end of the day, you're there for the child, and they
Yes.
are that sole purpose. So you want to make sure you're doing what's best for them.
It's
But
intentional.
also, yeah, and we're adults too. We have feelings too, and we have to work in a setting that is healthy for us. So
Hmm.
absolutely
Agreed.
love that y'all do that collaboration. So with that being said, what are some characteristics that you feel really makes a good RBT?
Um, a lot of patience.
Patience.
Willing to get hit. All right, and being able to get up and walk away.
Like, let's be honest, we can't complain because we got hit, on the elbow or the face. Like, yes, you have to have a tolerance.
Yes. There is a difference from like,
Was
go
that
ahead.
Ari? Hey, girl.
There is a difference, I feel like, from like when you have kids that can talk and they're not
Yes.
as um autistic, it's kind of like out of spite, like I'm just gonna
Yes.
do it because versus like kids who are on the spectrum and it's like they don't know how to they don't know how to communicate. So it's like I'm just gonna
Right.
do whatever to get it out of my system.
Right.
I've been slapped quite a few times.
Okay.
It's
Yeah.
okay. Like I've had to take a deep breath and be like, I gotta step away for a second, and that is
Mhm.
okay.
Yes.
Um, does the kid feel sad afterwards? You can tell like it hits them like, oh my God. So
Mhm.
I would honestly say like a lot of patience because you don't know who or what you're dealing with. It could be
Right.
someone very sweet or someone very aggressive who doesn't know or they've never had that opportunity to show them how to correctly communicate until they are
Right.
with us because we are registered behavioral
Mhm.
technicians, which is
Yes.
therapists. But just a lot of understanding, flexibility, flexibility in a lot of different zones. You're going to get up and you're going to be running all day. The kid doesn't want to stay, you ain't staying. You
Yes.
can't make them stay. You can't be
Yeah.
like, boy, I just sat down. You got to wait a minute. No,
Yeah.
whatever the kid wants, you want. So they're your boss.
Yes.
As long as you're okay with the kid being your boss, I mean, hey,
Mhm.
um, I would definitely say a lot of love. It does take some people have the patience and love for kids like this. I am one of those people. I am a big advocate.
Mhm.
I always have been for kids in general, but the ones who can't talk, someone's got to talk for them. And I feel like the compassion that comes with that it does matter because if you're there and you don't have to be there, then
Mhm.
why are you there? Because
Right.
it's, like what, like, why are you here? So I think
Exactly.
like one of my biggest things is like, oh, I don't have to do, and I'm just like, okay, but then why are you doing it? Like, I want to know
Mhm.
the why behind it, just to
Right.
see, because that just tells me right there, like, you're here because you want to be here, but you don't have to be here. So then it's like on some days you're not going to care,
Mhm.
and you're gonna have to care every day. Like
Yeah.
they're with us 6 to 7 hours a day, all
Yeah.
day long. So it's like they're clocking in and they clocking out, boss work. And
Yeah.
definitely like customer service, you got to be able to know how to talk to people. Um, when to say stuff, when not to say stuff, who to
Mhm.
confide in. So how we do it is like our my boss, she does trust us with talking to parents, but some might talk a little more than they should. And we
Mhm.
discuss it as it comes up because we're still growing.
Yeah.
Um, me being on that side, being over 37 teachers with you,
Yeah.
we've known how to coach the teachers on like, hey, like we say, oh yeah, Johnny had a great day, like we call it the sandwich or Oreo method, whatever you want
Mhm.
to call it. You can tell them, yeah, it's okay to have a hard day. They know they have a hard day because they're
Yes.
with us for a reason because they have behavioral issues. So they
Yes.
already know. So why are we going to focus on that? Like
Right.
the parents want to know, what are we doing? Like, what
Mhm.
are they overcoming? Like, oh yeah, like Johnny normally gets upset and slaps a friend who cries, but today he said,
Mhm.
I need a break. And we got up and took him away from the table. Like, that's a highlight. Like, you're
So
still giving, like,
when?
yes. And we do have kids that do that. And it's super amazing just seeing them grow. But at the end of the day, you're gonna have to have teamwork too, because you're
Mhm.
having to lean on everybody. You gotta trust, like, when I go to break and I give you my client, you're gonna be able to take that 30-minute data if something happens and I'm not missing nothing. That way I'm not like, okay, what happened? And
Yeah.
now I'm taking time away from my kid trying to figure out what happened while I was on break.
Right. Yeah. It speaks to the importance of making sure that you are building a relationship with the people that you're working with.
Yes.
Very important. Very important. Well, Chalina, thank you so much for answering all my questions and being my first guest on my Childcare
I
Teachers
guess.
After Hours. If you could leave us with just one token of knowledge, what would it be?
Mm, for the preschool or RBT side,
Either.
that's hard. That's so many. I would say, like, honestly, like, no matter what line of field you get in, especially with kids, you got to do it for the right reasons.
Right.
And just like I tell some of the girls, and we've told our teachers too, if you feel like it's time for you to go, just go, because then you're just torturing yourself and others around you. But I feel like if you're gonna choose to be there big, like go big.
Right.
Because at the
Right.
end of the day, those kids see you, they copy you, they love you.
Yes.
And I just feel like, I don't know, like I know a lot of people like the training, stuff like that, they take into account accountability once you're older. As we're knowing that some schools they do take those trainings. So any opportunity, jump on the train of trainings. Just anything, just always have an open mind and just try to learn others and team build, I guess. I don't know. There's a lot that we've struggled with that we've learned. And it's just, I don't know. It's a lot to just leave with one thing. But yeah.
Well, I think that was a really good note. All
Hmm.
right. Thanks so much for joining us. Childcare After Hours.